The Expanded Program on Immunization, or EPI, was established in 1976 to ensure that infants, children, and mothers have access to routinely recommended infant childhood vaccines. 6 vaccine-preventable diseases were initially included in the EPI: tuberculosis, poliomyelitis, diphtheria, tetanus, pertussis, and measles. EPI in Philippines currently are composed of 7 types of vaccines, given to age 1 year below. These are the following. 1. Bacillus calmette-guerin or BCG vaccine. 2. Hepatitis B vaccine. 3. Pentavalent vaccine composed of diphtheria, pertussis, tetanus, hepatitis B, and Haemophilus influenzae vaccine. 4. Oral polio vaccine or OPV. 5. Inactivated polio vaccine or IPV. 6. Pneumococcal conjugate vaccine or PCV. 7. Measles, mumps, rubella vaccine or MMR. The Bacillus calmette-guerin BCG vaccine is used to prevent tuberculosis, TB. The BCG vaccine is made from a weakened form of the bacteria that causes TB. It helps the body's immune system produce antibodies that destroy the TB bacteria. The vaccination is given soon after birth, usually by 28 days after birth. The standard dose of BCG vaccine is an intradermal injection of 0.05 milliliters of the reconstituted vaccine for infants aged under 1 year and 0.1 milliliters for infants aged over 1 year. The hepatitis B vaccine is a shot that protects against the hepatitis B virus. The vaccine causes your body to produce antibodies that protect against hepatitis B. The first dose is recommended within 24 hours of birth with either 2 or 3 more doses. The second dose given 1 month after the first, and the third dose given 6 months after the first. The hepatitis B vaccine is usually given as an intramuscular IM injection into the deltoid muscle in the upper arm or the anterolateral thigh. The pentavalent vaccine is a combination vaccine that protects babies from 5 serious diseases. It's given in 3 doses at 6, 10, and 14 weeks. It reduces the number of injections a child needs. It helps prevent the spread of serious diseases. Pentavalent vaccine protect against the following: diphtheria, a microorganism that infects the throat, causing fever, chills, and sore throat. Tetanus, a disease that can cause serious health problems. Pertussis, whooping cough, a microorganism that infects the throat, causing violent coughing spells. Hepatitis B, a microorganism that infects the liver. Haemophilus influenzae type B, a microorganism that lives in the mouth and throat. The polio vaccine protects against poliomyelitis, a viral infection that can cause permanent paralysis. There are 2 types of polio vaccines: inactivated poliovirus vaccine IPV and oral poliovirus vaccine OPV. Inactivated poliovirus vaccine, or IPV, is a series of shots that contains a killed virus. Can be administered intramuscularly or subcutaneously. The recommended injection site depends on the age of the patient. Injection sites for infants and small children is at anterolateral aspect of the thigh. For older children and adults is at deltoid muscle for intramuscular injection, or the posterior aspect of the upper arm for subcutaneous injection. IPV is recommended in addition to the oral polio vaccine, OPV, for the best protection. The inactivated poliovirus, IPV, vaccine is given in 2 doses to age 3.5 months and 9 months. The other type of polio vaccine is oral poliovirus vaccine, or OPV, is a weakened live vaccine given by mouth as a liquid, at least 2 drops. Schedule for OPV doses: 1.5 months old first dose, 2.5 months old second dose, 3 months old third dose, Both IPV and OPV can protect against 1, 2, or all 3 types of polio. Pneumococcal vaccines are vaccines against the bacterium Streptococcus pneumonia. Their use can prevent some cases of pneumonia, meningitis, and sepsis. There are 2 types of pneumococcal vaccines: conjugate vaccines and polysaccharide vaccines. Pneumococcal conjugate vaccines, or PCV, protects against 15 types of pneumococcal bacteria. The pneumococcal conjugate vaccine is typically given in a series of 4 doses for children under 5 years old. The doses are given at 2 months, 4 months, 6 months, and 12 to 15 months. Pneumococcal polysaccharide vaccine, or PPSV, protects against 23 types of pneumococcal bacteria: measles, mumps, and rubella, or MMR. The MMR vaccine protects against measles, mumps, and rubella. It's very effective and helps prevent serious complications from these viral diseases. Whereas measles caused by rubeola virus, clinical symptoms are fever, cough, a red rash or Koplik spot, and red eyes. Mumps caused by clinical symptoms are headache, muscle aches, fatigue, and painful swelling in certain salivary glands. And rubella, also known as German measles, caused by rubella virus. Clinical symptoms are fever, sore throat, and a rash that typically starts on your face and spreads to the rest of your body. Complications for pregnant women acquiring the virus is called congenital rubella syndrome. MMR is administered through subcutaneous injection of 0.5 mg during 9 months and 1 year old.